Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. Today's episode is the last of 4 podcasts in our series addressing collaborations in care during the course of HBV management. Each episode, like this one, features brief conversations between a physician and a patient. Today I'm joined by Professor George Lau in Hong Kong, China, and one of his patients living with hepatitis B. Together, we will address key pillars to HBV care, including the importance of adhering to antiviral therapy and early surveillance for hepatocellular carcinoma. Professor Lau has been this patient's hepatologist since he was diagnosed with chronic hepatitis B in 2009. At that time, the patient started antiviral therapy based on his laboratory findings, with an elevated ALT and elevated HBV viral load. However, after a few years on therapy, the patient decided to stop his medication and instead take an herbal medication. Professor Lau shares with us that medication non-adherence continues to be a challenge for many of his patients living with hepatitis B. In addition, patients using herbal medicine for chronic hepatitis B management is common, and as we will see, can result in adverse outcomes. Let's hear about this patient's experience.
I went to the Chinese medicine. He recommended if you take the medicine for until when you're old.
Well, this is very unfortunate, and there's as usual stories for some reason. And in this particular case, the patient was advised by a herbalist to take herbs instead of effective antiviral. And unfortunately, the patients take his advice. And what happens then?
Not feel good and just
You feel terrible.
Doesn't have an appetite, and then just cannot sleep, and it's getting really bad. And I call him. I think I stopped for a month.
Yeah,
so,
he did give me a call.
Yeah.
He was also noticed to have darkening of the urine. In fact, he go into jaundice, and he has a very bad flare related to withdrawals on the antivirals and also put on herbs. The HBV DNA goes back to 6 to 7 logs, and ALT levels is greater than 3,000. The jaundice, he is very jaundiced, and the bilirubins reached almost 100. And he was hospitalized and was immediately restarted on a double antivirals with entecavir and tenofovir. And I think you stay in the hospital for 2 to 3 weeks, right?
Yeah, almost 3 weeks. I'm thinking I'm going to die because it's really quite uncomfortable and lie down the bed. You can't really walk up, and no appetite, and so skinny, and I'm thinking I'm just not ask Mr. Liu, well, tell me how long I can alive. Tell me how many times I still have.
Fortunately, this patient recovered after this hospitalization, but this is not always the case. Here, Professor Lau shares his experience with another patient who self-continued their antiviral therapy.
We have circumstances these patients suffer even more and requires either liver transplantations or even succumb. So this is a very strong message, and I hope this will bring to the attention to all the healthcare providers and also patients that patients cannot, if they chronic hepatitis B, they should not stop the therapy by themselves. In fact, one of my other patients who obviously cannot be interviewed right now, that he stopped the therapy by himself. And then he come back to me, give me a call 4 or 5 months down the road. He was deeply jaundiced, and I arranged the liver transplantations in Hong Kong for him, but the patients cannot survive before the transplant get initiated, and the patients succumb. So sometimes patients, for multiple reasons, they stop the therapy by themselves, and this could cause serious problems. So compliance to antiviral therapy is very important for these type of patients. I think this is the most important message.
Maintaining medication adherence is not the only thing patients with chronic hepatitis B need to adhere to in order to manage their infection. Keeping up with lab monitoring is key to evaluating disease progression, including risk for liver cancer. For this patient, monitoring was key to uncovering liver cancer early.
The patients sitting right in front of me was then followed up stringently and being monitored every 3 to 6 months, not just for the liver functions and the antivirals effectiveness in terms of HBV DNA quantitation, surface antigens, and also ALT level, but also with HCC surveillance. And well, fortunately, the patients was picked up to have early hepatocellular carcinomas in 2021, and he has liver resections, and the patient is free from liver cancer until now. Up till now, he's still free from liver cancer. So maybe you want to mention some of the issues related to your second admissions for the management of liver cancer.
That was
2021.
Well, you told me my blood is a little bit something.
That's the alpha fetoprotein.
Yeah, a little bit high. But within about 2 years ago, and I keep checking, but the level is still a little bit getting high. It's about be something wrong. He told me to take the CT, and then he keep following me to check up. The blood is getting higher. The blood protein.
Alpha fetoprotein.
Yeah. I don't feel anything. I feel I'm all right. I'm keep playing badminton. I'm eating everything okay. I said, why I should go to the hospital? And then can I go later? And when I do the CT, I found something, shadow a little bit. Okay, can I finish all my job at the moment? I come maybe next month. And then he said, no, I already arranged the hospital and the room for you to do the surgery. And then cannot wait. And then I go just after a few days. Yeah. I don't feel any not feeling. I'm everything okay. So that's why I said, can I go later or something? He don't let me go later. He just go. You have to go immediately.
The message, I think, is very important that we have to be very stringent to explain elevated alpha fetoproteins in patients, especially keep on rising despite a negative imaging studies or animal imaging findings at the very beginning. And the continuous monitoring is important, especially if patients have a normal ALT and have no other reasons for elevations of alpha fetoprotein. I think this is a key message. So it's not a cross-sectional surveillance, but on continuous follow-up. So surveillance is important, and continuous surveillance and monitoring is also important, especially in those patients with rising alpha fetoprotein. And so you do not rely on one single imaging assessment for these type of patients, unless you have other reasons to explain for the fetoprotein raised.
As Professor Lau shares, some complications can occur when patients are asymptomatic, further emphasizing the importance of routine monitoring.
Because they have to wait for the cure, and they are not suffering for anything. They are not suffering. So it's sometimes people will think that this will not happen to me. Many a times, as a medical center, we proactively will remind the patients to come in if they missed a follow-up period of 6 months. So we try to get the patient back every 6 months. And sometimes we have difficulty because of the traveling and so on, but we try our best. I think this is a very important system, because then even for my patient sitting right in front of me, he has compliance problems, but our nurse trace him back, managed to pick up early cancer, liver cancer, and bring him to a curative path with raised alpha fetoprotein, and then a continuous follow-up. And then eventually we find the liver cancer 1 year down the road after the initial elevations of alpha fetoprotein. So it takes a long time for liver cancers to develop, sometimes to a size that we can pick up or confirm on imaging.
It was clear the patient was thankful that his liver cancer was identified early. I asked him what he would like to share with other patients with chronic hepatitis B. In particular, what advice he has on routine lab monitoring.
Quite important to check out every 6 months. Yeah. I think you should take it more serious to that. I have to.
Easy to say, but difficult to do. And I think our responsibility as the healthcare provider, we need to remind our patients, especially asymptomatic. And time flies, so everybody is busy about their lives, and sometimes it's difficult to have them remember, especially a 6 monthly interval, and time flies. I think this is the only way to pick up early liver cancer and to reduce the liver morbidity and mortality relating to chronic hepatitis B. So he has suffered from 2 complications for chronic hepatitis B.
Likewise, I asked the patient what other advice he would like to share based on his experience living with chronic hepatitis B. He re-emphasized the importance of medication adherence and how establishing a routine has helped him.
I think once you take the therapy, you have to follow. Don't frustrated. Now I'm really, every day I'm taking some. I still remember that. The first thing I wake up, I take medicine. Now it's more stable on taking the medicine for me.
Thank you very much to Professor Lau and his patient, and thank you to our listeners for joining in. In this podcast, we learned that patients may encounter different barriers to HBV care, and it is essential for healthcare professionals to collaborate with their patients to overcome these barriers. For this patient, the key to his care was promoting medication adherence and performing routine screening for hepatocellular carcinoma. Setting up a routine helped improve his medication adherence. In addition, receiving reminders from the clinic staff helped the patient to keep up with his medical and lab visits, which allowed him to receive early intervention for his liver cancer. To learn other strategies to individualize HBV care and to view the full program entitled Mind the Gap, Aligning Real-World Practice with Best Practice in HBV, go to the Clinical Care Options website. And to get access to all of our podcasts, subscribe to the CCO Infectious Disease Podcast on Apple Podcasts, Google Podcasts, or Spotify. Thank you and have a great day.